Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Wei Zhang. She's a postdoctoral researcher. Today's Kevin MD article is Peripheral Artery Disease Prevention, Saving Limbs and Lives. Wei, welcome to the show.
Thank you so much for having me, and it's a great opportunity to talk about my topics here. So I would like to give a brief introduction of myself, and I'm a medical scientist in cardiovascular medicine, and I received my clinical training in vascular surgery in China, and also the research training in both China and Japan. And currently, I work as a researcher at the Yale University. And my work mainly sits on the intersection of the vascular disease surgery and the long-term of the patient outcomes. And I work on the vascular graft building and the optimization of the existing cardiovascular devices. And to guide my work, I have followed very close of the patient outcomes in the real world. And the patients with peripheral artery disease is one population that I have paying particular attention to. And patients with peripheral artery disease, it is a chronic progressive disease. And however, it's the limited early diagnosis and the access to the advanced treatments may lead to those devastating outcomes, which is limb losses. And it has been attracting attention now because the rate of the limb losses has increased more and more in recent years, especially what the study that I talked about in this OPED. And this study has been led by the doctor at the State University of New York. And they have trained patients who have the amputation from the 1993 to the 2023 in US. And they have found that after years of the decline till the 2010, the trend just reversed and a big increase of 9% per year. And it's kind of caught my attention because we have seen lots of the technical innovations in past 2 decades. But after the 2010, the trend of the amputation reversed again. So this has been motivated me to write this op-ed to let me step back and ask what really does better for our patients. And in clinical practice, how we can do to make those patients have the better outcomes and good for the public health.
So, in your article, you mentioned that there's a 9% annual rise in amputation rates from peripheral artery disease. Currently, how often is peripheral artery disease being screened? Do you feel like it's commonly being screened? Do we have any data suggesting how often peripheral artery disease is being screened in the primary care setting?
There is no specific data about that, but the underdiagnosed of the peripheral artery disease is still a major issue, especially in the primary care, because patients sometimes they present to the primary care and talk about their symptoms. The healthcare workers maybe think it's not serious enough and we can wait to see. But after then, when they finally feel those kind of severe, like unhealing the sore, all those severe symptoms, and finally transfer to the vascular specialist, they found that there is less chance for the limb salvage and lead to the final limb loss. So and also before they present to the primary care, some patients may feel the leg pain and the numbness, but they don't take it very seriously. So also when they present to the healthcare workers, sometimes it's kind of late stage of development, and you do really have few choices for the treatment.
In your article, you talk about socioeconomic status, and sometimes that affects the complications of peripheral artery disease. Talk to us about some of those disparities.
Yeah, actually, this is a very critical factors that has impacted those limb loss disparities, especially among the low income zip codes and also among the Black people, Hispanic, and Asian patients. They have a relatively higher limb loss rate compared to the white people. And I think there has been two factors of this problem. One is that socioeconomic is very important, and some patients, for those low income patients, usually they have the limited access to the primary care. So when they finally present to the primary care, the development has been late stage and lead to the necessary limb loss outcomes. And another situation is that the shortage of the primary care workforce, especially for the U.S. healthcare system, it has relied very heavily on the immigrants' healthcare. And especially for those underserved and rural area and the immigrants' healthcare, they have disproportionately represented in those areas. And speaking of that, the recent data has shown that 1 in 5 U.S. healthcare workers are immigrants,
Hmm.
and it's around 80 to 90%. And in the current situation, yes, the restriction of the immigrants will also impact for the healthcare workforce, and such kind of gap once it has formed, given the long term of the medical training, so it would be more difficult to fill up this gap. So I think both parts, like patients' economic situation and also the shortage of the primary health care, they have led to those kind of disparities.
In the primary care setting, in the exam room, what are some typical symptoms that would make a clinician think about screening for a peripheral artery disease? Just give us some basic stories and how patients may present.
Yeah, and first you need to pay attention for those symptoms like limb pain when they walk, they cannot walk as they used to walk, and also they may have those numbness and cannot really feel the temperature, and those kind of neuropathology and changes. And also you need to screen their in a combination like they have the high blood sugar or the hyperlipidemia or hypertension. You need to pay attention for those patients. And for those kind of screening tests like ABI and those testing, maybe the primary care they're not equipped with those instructions. You can once you have suspect or you want a patient to do some advanced screening, you can directly transfer to the vascular specialist, and they have those vascular labs to provide those equipments to further assess the vascular condition of those patients.
And you mentioned ABI, that stands for ankle brachial index. It's the ratio of the
Yeah.
blood pressures in the brachial artery and the ankle that could sometimes suggest peripheral artery disease. Now, you talk also about some of the technology that we have today when it comes to treating peripheral artery disease. So tell us some of the things that are new that we didn't have previously.
Yes, and over the past 2 decades, the endovascular equipment that has lots of innovation, especially for the vascular surgery. And the patient don't really need to go through the open surgery. They just using those endovascular procedure to get the minimally invasive treatment to reopen your vessel and recover your blood flow. And actually, I was surprised because with the innovation of the technology, you should see the decline of the limb loss, those devastating outcomes. But it turns out, even though with those innovations, you still see the increase of the limb loss. Yes, the early diagnosis is is one point, but another thing that I also triggered the discussion about this study is that people think maybe now there are more specialties like radiologists, cardiologists, they are also involved in the endovascular procedure. And in different scenarios, actually people have the different indication and also the treatment threshold will be varied among those different specialties. And sometimes when those tools are available, we don't really think too much about the future plan. So that means we do really want to achieve the instant perfect blood flow in at the moment, but with those so many treatments has been put in, at least actually it has leave less room for the future treatment plan. And it's also one point that has concerned some specialties currently, and we're thinking that maybe do more is not doing better. We do really need to think about the future treatment chance when we do when we assess the current situation.
So it sounds like there's a spectrum of treatment options. It's not just straight to surgery. Like you mentioned, interventional radiology has some less invasive treatment options. As far as you know, any outcomes data regarding these different modalities to treating peripheral artery disease?
Among the different specialties, actually there is no those data compared among the different specialties. But actually people has followed up compared the open surgery and the endovascular procedure. But actually people are more considering different procedures for the certain disease, like when we're using the drug-eluted blue or when we're using the drug-eluted stent to treat those patients, they usually compare the different endovascular procedure. But in early data about comparing when the endovascular procedure emerging at an early time, people do really have the comparison, but I have not really see those data clearly. But the trend of the endovascular procedure in clinical practice is now more popular.
You talk about the economic impact when it comes to screening for peripheral artery disease. You give a number, $11 billion. That's the financial burden of limb loss. So talk more about the economic impact when we screen for this earlier.
Yeah, if you do really screen earlier patients, you really just need to use the medication treatment, or you can directly use when the disease has advanced, you use the endovascular procedure or procedure. Those are those are cheaper compared to the limb loss surgery because when the disease has developed to that stage, it cannot save the limb. You need to do the amputation, and after the amputation, you need to join the rehabilitation program, and also you have lots of economic burden when it comes to your personal life. So compared to the early treatment, just for the medication or endovascular or open vascular surgeries, the limb loss surgery and also the following the cost of the personal life cost is much higher compared to the early intervention.
So if I'm a patient and I'm listening to you on this podcast, tell me some of the signs and symptoms, or even some of my demographic characteristics that would prompt me to ask my clinician to screen for peripheral artery disease.
Yeah, first, if you have feel some abnormality of your limb, like when you cannot walk as fast as you can, and also you feel some leg pain when you walk long distance, or you feel some numbness, or you found some sore in your wound that cannot heal in time, you should go to the doctor to say, "Oh, I have those symptoms." And also, it's important to tell the doctor if you have the family history of those cardiovascular disease, and also do those kind of screening about your hypertension, take care of your blood pressure and your blood sugar, and your also do those lab screening of your other index that can let the doctor give you some kind of screening of your basic situation to see whether it is necessary to refer you to the vascular specialist for the advanced assessment of your situation. And yeah, yourself, especially when I think for patients, especially when you have the family or relatives, they have those kind of cardiovascular history. You need to pay attention for your own cardiovascular health because this kind of a genetic issue is also one important deal in the cardiovascular disease.
And I just want to add to that, of course, smoking history as well plays a huge role in
Yeah.
peripheral artery disease.
Yes, smoking and alcohol.
We're talking to Wei Zhang, postdoctoral researcher. Today's Kevin MD article is Peripheral Artery Disease Prevention, Saving Limbs and Lives. Wei, let's end with take-home messages that you want to leave with the Kevin MD audience.
Yeah, I just want to emphasize the pathway from the vascular disease to the limb loss is often known, but the impact of the amputation, it is profound. It can affect the mobility, independence, and the dignity, and also your quality of your life. And the patient's awareness still remain limited. And also the primary care. This is the first and the most important gate care for the early detection. So it is still underutilized in preventing the peripheral disease progress. And also to preventing the limb loss, it requires coordinated and system-wide efforts from patients to recognize the early symptoms to primary care, podiatry, and wound care, and also the vascular specialties. They need to work together to prevent this kind of devastating outcomes. And the disparities that we are seeing today, it has been driven very critically by the unequal access to the care and the socioeconomic factors that has been combined by and also combined by the workforce shortage. So I think to really decrease the limb loss, we need many part of the efforts to work together to decrease this kind of limb loss and to really improve the quality of life.
Well, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much for having me.